Good morning, Peter Goertz. I'm a psychiatrist. Is being a psychiatrist a wonderful profession? In my opinion, yes. Are there tricky decisions you will need to make? Yes. Today, I'll talk about how far does doctor-patient confidentiality go? And I'll give actual examples of patients I've seen. One example is a patient who actually worked in the same organization that I worked in, and the patient mentioned that he was using a substance, and if the organization would find out, he might lose his job. What am I going to do? Tricky decision. Do I document what he said in the record? So, tricky issues come up, and we want to, in my opinion, strike a balance. I'll give more examples, then I'll talk about the general issues some more. Another patient was on probation, mentioned to me that he was using a substance. Do I document that? If someone sees the records, is the person going to go to jail? Again, tricky decision. And with the first patient also, since he worked in the same organization where I was working, would someone be able to look at his chart if I document something also? A patient told me that he'd been working and his job was to kill people. He said he was not doing that anymore, but he had done that. Do I document that? What about my own safety? If I document that and the patient sees his record, or if I tell the patient I'm documenting that, am I going to be safe? Another patient was not coherent on a medical floor, was adamant about me not calling her husband. What do? I don't have a whole lot of information about that patient. Do I need to call the husband? Again, tricky situation because a non-coherent patient on a medical floor, serious medical problems. I basically feel like I need all the information I can get. Do I call the husband? Yes or no? A child in an emergency room who is suicidal tells you about another student, a friend of the child's, who had told the child that they were suicidal. What do? Do I need to, probably the other child had told the patient in confidence, do I need to tell someone? With children, I think it's somewhat easier because you do need to notify the parent or whoever has custody of the child anyway about what's going on. And if the child tells you about another student who is suicidal, it seems important to make sure that that child gets attention, make sure the school is notified, for example. So basically, we're talking about, at least in some instances, safety. So there was a ruling, and it was based on what happened with a student, I think at one of the colleges in the University of California system, Tatiana Tarasov. And she, I think, had some interaction with another student who became very enamored with her, but she never got involved with him. As far as I recall, that was more or less the story. And then the other student, a male student, told his therapist, psychotherapist, that he was having thoughts of killing Tatiana Tarasov. The therapist initially, to my knowledge, notified the campus police, was very concerned about the safety of Tatiana Tarasov. But then the therapist consulted with her supervisor, who I think was a psychiatrist, and the psychiatrist said, this is confidential. don't do anything. And I think then the campus police were told that there's nothing to do, and nothing happened. So Tatiana Tarasov was not notified. And then I believe about 2 months later, the other student killed Tatiana Tarasov. And the parents sued, and there were then 2 rulings successively over the years that were made. And in the Tarasov 1 ruling, there was an obligation for the treating person, so in this case it was the psychotherapist, to warn the intended victim. So to make sure that the intended victim, in this situation it was Tatiana Tarasov, that she was warned that the other student had thoughts of killing her. Then, I believe a few years later, there was a second ruling, Tarasov 2 ruling, and that was the duty to protect the intended victim. So you could do that even without notifying the intended victim by, for example, hospitalizing the student who wanted to kill Tatiana Tarasov on a psychiatric ward. That way he would be locked up, at least for the time being, and she would be protected. So there are several issues, like I said, including safety of the patient, of others, of yourself. And then, of course, there are legal issues. You want to adhere to laws, ethical issues. And then there's the issue of personal integrity. You want to be able to look at yourself in the mirror and feel reasonably good about yourself after a day's work. So let's real quick go back to those cases that I mentioned. So the first case, the patient who worked in the same institution, bottom line with all these cases, in my opinion, the ultimate decision is a judgment call. There's no black or white. And in this first situation where the patient was working in my institution, do I want to document what the patient said about using a substance that was not legal and the patient could have gotten fired if the institution found out that he was using that substance? Do I want to document that? Tricky question. And maybe part of the issue is it really crucial for the patient's treatment that is documented in the chart? So you want to ask yourself that maybe on a case-by-case basis. The patient who is on probation, same type of issue. Is it crucial? Is it just an occasional thing that he uses a substance? Is it crucial for the patient's treatment that is documented in the chart? Again, judgment call in my opinion. The patient who had been working and his job was to kill people, do I want to document that? Again, interesting question, tricky question, judgment call. As a general rule, I don't think there's a clear answer necessarily, and you want to be careful about your own safety. Now, since that killing was in the past and he reported that he was not doing that anymore, there was no, in my opinion, no obligation to call the authorities because there was no potential victim at that point. He was not saying he was going to kill anybody. So as far as safety, I think safety of others, let's say who he could potentially kill, I don't think that was an issue because he was no longer working in that, doing that kind of work. The patient who is not coherent, who did not want me to call her husband, I felt in that situation it was important to call the husband for the patient's own safety because I did not have a whole lot of information about the patient, and I felt it was important for the patient's safety for me to call her husband So, again, a judgment call. If I had had a lot of information about the patient and felt, well, maybe it's not really necessary to call the husband, that might have been a different situation. With children, like I said, it's different because they're minors. We do need to call whoever has custody for the patient, for the child, if there's any issue that the person who has custody needs to know. So that's a little bit different, but then there was a somewhat tricky situation in that another student may have told the child in confidence that the other student was suicidal, but still they're both children. It's important for the school to be notified so that the other student gets help, and well, for someone to be notified so that the other student gets help, and we want to ensure the safety of the other student. So if you have questions, it seems important to consult with a colleague. So I would feel free to do that and get as much information or opinion, get another opinion from a colleague, and that definitely can help. So there's magic in all this, in my opinion. These are not black or white decisions, in my opinion, and I think that's part of what's attractive about psychiatry, that it's not very often not black or white. There are a lot of gray areas and a lot of judgment calls to make. But again, to me, that's part of the magic of being a psychiatrist. Thank you.